We're now going to zero in on the role of speech-language pathologists. Dr. Paul Rayo is the current president of the American Speech-Language Hearing Association, and he's kindly agreed to talk with us today. Paul's not only a speech-language pathologist, but also a hospital administrator at the National Rehab Hospital in the District of Columbia. I've asked him to think about patient-provider communication issues in healthcare settings today and how ASHA and its 145,000 members can help have an impact. Welcome, Paul.
Thank you, Sally. I very much appreciate it. It is indeed an honor and privilege to present this afternoon on behalf of the American Speech-Language Hearing Association. We're talking about effective patient-provider communication, and I will speak briefly about ASHA's vision and mission. Clearly, speech-language pathologists and audiologists have all of the necessary skills, knowledge, and abilities to meet this niche, an important niche within the healthcare community. We already have these services available. We're able to provide these services. We stand ready to assist all care providers and all those who need our services. We have already shown a track record of collaborating with families and patients in other disciplines. We're extremely team-driven, so we are ideally suited to fill in this niche. And finally, our common goal is improving communication access for all individuals and for all people. So what is ASHA's vision? It's making effective communication a human right, accessible and achievable for all. It is an inspiring vision. And if you look at ASHA's mission, we have two that are particularly germane to this topic of assisting persons with communication challenges: empowering and supporting speech-language pathologists and audiologists and speech and hearing scientists in first advocating on behalf of persons with communication and related disorders. Literally, advocate from the Latin, shout out. Also advancing communication science and then promoting effective human communication. It is clear that these three missions fit very neatly under our mission. There is an extremely vulnerable population out there in the millions. If you look at folks with communication disabilities, we're talking about almost 36 million who are deaf, hard of hearing, and have speech-language defects. People with limited English proficiency, almost 50 million. And people with limited healthcare literacy, almost 100 million. So there are a large population, there is a large population that really needs our assistance because we are the experts. Health literacy. Let me tell you a little story about health literacy and patient safety and about able to understand complex instructions and are not always able to make a reasonable advised consent. Marie's husband, Mitch, had a massive stroke that resulted in aphasia and dysphagia. Marie was by his bedside the whole time. And on day 7 of his stay, she gave consent for Mitch to have a percutaneous endoscope gastrostomy tube inserted, not really knowing that it was a feeding tube, a procedure that defied the family's wishes and his advance directives. They did not understand. And if you look at an accident waiting to happen in healthcare, this is a good example. Far too often, our citizens are at risk for unapproved and unsafe care because they do not have adequate or sufficient literacy skills to understand the jargon, the alphabet soup, and the unclear language. Interestingly, in an editorial in 2006, Schilling, in Misunderstanding Prescription Labels, pointed out the elephant in the room is the U.S. healthcare system largely operates under the assumption that all patients have high English language literacy skills. Not true. In fact, many do not. And Davis carefully shows that a substantial portion of users in the U.S. healthcare system really don't understand or are unable to correctly execute the instructions on even prescription labels. Scary. And so what are our roles as speech-language pathologists and audiologists in improving communication across all healthcare settings. This is the challenge. What are our roles? First, we have a responsibility, as I said, with advocate, shout out, to communicating with administrators and staff about the essence of the challenges we face. We should be working with our colleagues to draft policy and procedures that address communication access, which is a human right, hopefully achievable and accessible. Understanding the added value that we would bring, that communication supports brings with AAC and AT designated communication persons that bring effective patient-provider communication. And how about teaching others, nurses, therapists, about these options? Many times they're naive to it. And collaborating with and supporting other healthcare providers in enhancing communication across healthcare settings. So, I want to stress this word. I've said it 4 or 5 times already, advocacy. Effective patient-provider communication is a healthcare advocacy issue. Let's bring our unique training and expertise to bear to help solve a national problem that's increasing and very, very significant. Daniel Webster said, if all my possessions were taken from me, with but one exception, I would choose to keep the power of communication, for by it I would soon regain all the rest.
Thank you, Paul.
Thank you, Sarah.
Paul made several very important points. He's got the bully pulpit, and as he said, it's time to shout out. ASHA members should be at this table. There's a need to collaborate with other professionals, and we can do that. As well, ASHA members bring evidence-based strategies and tools that can be used to help solve patient-provider communication problems.